drugs, prices that are soaring for many at 10 times the rate of inflation. These are demanded by government-approved monopolies. Using the market power of Medicare to negotiate lower prices is certainly not a new concept. Republicans rejected a proposal that I offered before Medicare Part D was even written into law back in 2006. Later in 2007, the House of Representatives approved a Medicare negotiation bill with every single Democrat who voting for it, and joined in a bipartisan way by 24 Republicans. More recently, I've joined important proposals that Congressman Welsh and Congressman Cummings have authored. And while today's proposal is not new on that concept, it is a new proposal that is being introduced by almost 70 of us to make the negotiation process successful. 3 parts. First, as these earlier proposals have done, we would repeal and replace. But we would repeal and replace the current Republican-imposed restriction on Medicare negotiations so that Medicare could negotiate in much the same way that the Veterans Administration does for lower prices today. Second, if the negotiations are not successful, we authorize the use of competition to lower prices. And third, during the transition period that is necessary for generic competitors to get approved, to manufacture, and to market, a lower interim price would be set for each pharmaceutical based upon what the price is in the largest, most developed countries around the world. Let me focus just a moment on the competition point. If negotiations reach a stalemate, the Health and Human Services Secretary would be authorized to issue competitive licensing agreements for generics to compete with a brand name drug. This month, the current Health and Human Services Secretary, who has more than a little experience with prescription price gouging, tweeted, quote, "President Trump, like all Americans, knows more competition means lower prices." Well, we all agree. And we want to expand the availability of generics through our legislation, which of course would pay a reasonable compensation to those who hold a government monopoly, but would end the monopoly if negotiation was unsuccessful. It was President Trump himself who said, quote, "Pharma has a lot of lobbyists." Come on up, Congressman, and doctors, we're glad to have you here. Please come join us. I know you've had a busy morning. President Trump said, "Pharma has a lot of lobbyists." And of course, we know there are 2 to 1 on us in the House in terms of the number of those lobbyists, and a lot of power. And there's very little bidding on drugs. We're the largest buyer of drugs in the world, and yet we don't bid properly. And we're going to start bidding, and we're going to save billions of dollars. Well, in short, the bill we offer today calls the president's bluff. It will give him that bidding authority that he wants, and it will back it up with good old American competition through competitive licensing. And we must act because so many families are suffering from Trump's inaction and his failures. After his troubling placement of the administration's prescription drug policies in the hands of pharmaceutical executives that he hired, Trump's weak, very weak, recent Rose Garden announcement has hardly come up roses. In 56 days since he made promises in the Rose Garden that we'd have major price cuts coming in just 14 days, one drug maker after another has done just the opposite and spiked their prices. Trump's big accomplishment is that some manufacturers have temporarily postponed raising the high prices that they were already charging at the time of his announcement. It is true that Merck, one company, announced reduced prices on a few of its products, but that narrow action really points to the value of what we're proposing today. Merck reduced prices not on its best-selling, highest-priced drugs, but on those where it needed to lower the prices to meet competition, mostly where there was already a generic in the market. Where there was not competition, Merck kept its exorbitant monopoly prices. Where there was competition, it lowered prices, and that's what we're after. And that's why our new legislation, which can achieve competition across the board, is very much needed. It's time for patients to be put over price gouging. Negotiation, bidding, competition, a truly American way to get Americans affordable drug prices and to start putting America first instead of last. I want to thank all of those who participated in developing this legislation, particularly Public Citizen and Social Security Works, from who we will hear today. But I want first to recognize colleagues who have played a big role in this and authoring the bill, who have tried to get this problem resolved in so many ways, including going to the White House last year to actually meet with the President. I would call up first Congressman Peter Welch.
Lloyd, thank you. It's good to be here with you again. And Elijah, we endured that meeting with the President and Ro Khanna and everyone else here. I say endured it because the President gets it. He said we need bidding. Lloyd mentioned that. He knows that the prices are a rip-off price because of the monopoly that is granted to the pharma companies, and then their abuse of that by evergreening and doing one thing after another to stick it to the consumer, to stick it to the taxpayer, and by the way, to stick it to a lot of good employers who want to provide good health insurance for their employees. And the unique situation that Congressman Doggett has pointed out is that we're the only country where the government doesn't step in to help consumers when they're getting ripped off by pharma companies. And the pharma companies start the ripoff because they get a government-granted monopoly and then abuse it to impose punitive, relentless, exorbitant, gouging prices on consumers. And it's causing an immense amount of pain. And it's true that we need good drugs to alleviate suffering, to extend life. But that's not an excuse to kill people with the prices. And that's what's happening with copays and deductibles. And it's just got to end. And what's terrific about Congressman Doggett's legislation is that it says if you are going to abuse the government monopoly that you get, the government is going to step in and stop you from abusing consumers. So, Congressman Doggett, thanks. This is a good, solid, additional tool that we need to give to the government. But the fundamental question, will we act? And we're going to be back with a new Congress, hopefully a different Congress, in January. And when we arrive, we want to hit the ground running with Congressman Doggett's bill, with Congressman Cummings' price negotiation bill, with the Fast Generics Act that I'm a sponsor of, with the Competitive Drugs Act, Congressman Doggett again, with the Affordable and Safe Prescription Drug Importation Act, thank you, Congressman Cummings, with the Transparent Drug Pricing Act, and with the Fair Drug Pricing Act to Congresswoman Schakowsky. These all share one thing in common, and that is that we believe your government, our government, has a duty to protect health and safety and access. And unless we address the price gouging, access is going to be out of reach. We are going to change things. Congressman Doggett, thank you for this solid legislation that is going to help us do that. Now I want to turn it over to really a leader in Congress on a lot of things, but especially on prescription drug price fairness. And that is, of course, Elijah Cummings from Maryland. Elijah, come on up.
Thank you. Thank you very much. Thank you. Thank you very much. And good morning, everyone. Want to thank you, Congressman Doggett, for this legislation. We've tried to do everything in our power to address these drug prices, and this is another way that, in a very effective way, that we hope to accomplish that. And certainly to Peter Welch and Congressman Khanna, I am very, very pleased to be here. To all of our friends, you know, I don't want to repeat what Peter and Congressman Doggett has already said. So I just want to give it another little twist. Our colleague, Congressman Delaney, has a saying, and he's from Maryland, and he says this: he says the cost of doing nothing is never nothing. Think about that. The cost of doing nothing is never nothing. The president, as Congressman Welch has said, told us in the White House over a year ago, and he re-emphasized that the pharmaceutical companies were getting away with murder. Those are his words. He said that he was going to do something to lower drug prices. And as Congressman Doggett laid it out very clearly, you see what's happened. Prices are not going down, hello, they're going up. And so what we have to do is take proposals like this and make them happen. As I've said many times, talk is cheap. But Nancy Altman will tell you that one of the main reasons why she's here, and Rob Weissman will tell you the same thing, is that they see how our seniors in particular are being affected, and others, by the way, by drug pricing. In my community, a lot of times the only assets a person has is a Social Security card and a Medicare card. That's it. And so we have a situation where people cannot afford the drugs that they need. When I was in the hospital for 6 months, I had a chance to really talk to a lot of people, a lot of patients. And you know the thing that hurt me the most was the people. Well, a lady said to me one day, she says, "Congressman, I was able to get into Hopkins to get the treatment, but I won't be able to afford the medication to get the cure." Oh, God. Wow. I could get the treatment, but I can't get the medication to get the cure. And so we are a country that is better than that. And, you know, I'm telling you, we are determined. When we take this House back, as Peter and Congressman Doggett has said, it's going to be a different world. I love the idea that in my committee, hopefully, I'm the chairman, and we have subpoena power, so we can bring in some of these companies and find out what is this all about, and why are you putting a gun to Americans' heads and saying either you pay big time or you die. We are better than that. And so I'm excited about the legislation. It's important. It's a way to be effective and efficient, and it's a way to bring the pharmaceutical companies around so that people can afford the medication that we need. We only have one life to live. This is no dress rehearsal, and this is that life. And so again, Congressman Doggett, I thank you for your splendid leadership.
Thank you so much. I know you've become an unwilling expert on health care, and we appreciate your coming over today. And I'm so pleased that Congressman Welch mentioned some of the other legislation that's out there, because what we know is there is no panacea for price gouging. But all we've gotten so far is a placebo, and we're about finding the package that will get the job done. Rob Weissman, as President of Public Citizen, has played such an important role in the development of this legislation, and I'd like to invite him to make a few comments. Rob?
As Congressman Doggett said, when Medicare Part D was adopted, everybody knew that the idea of preventing Medicare from negotiating drug prices was a preposterous notion. But it got in the law anyway, thanks to one of the most corrupt moments in the history of the U.S. Congress and the pharmaceutical industry leveraging their enormous political power. Everybody knew it in 2006, they knew it in 2008, they know it in 2010, they know it in 2018. You can't have the government mandated to provide coverage for pharmaceuticals, give the pharmaceutical companies monopoly pricing power, and then forbid that same government from negotiating the prices. Or if you do, you know what will happen, which is you will be ripped off beyond compare. And that is, in fact, what happens. At Public Citizen, we've studied this pretty carefully. We know conservatively, if the government gives Medicare negotiating power over prescription drugs, we, the American people, and we, through the government and as consumers, will save $16 billion a year conservatively. Conservatively. And everybody here knows it. Everybody in Congress knows it. Everybody who knows anything about the pharmaceutical industry knows it. There's only one real reason it doesn't happen, which is the political power of big pharma. But there's one other reason too, which is an excuse that pharma has conveyed, a fig leaf for their exercise of political power. And that fig leaf is, if you have price negotiations, it will lead to rationing. There'll be formularies and people won't get the drugs that they need. Okay, that's not true. We know it's not true because the VA does the same thing and there's no problem. In fact, the private pharmaceutical plans that operate prescription D, they do the same thing. But in any case, the argument has some resonance. What's so important about this legislation is it takes that argument off the table. There's no issue now about not getting access to drugs. Every drug will be provided at a reasonable price thanks to the introduction of generic competition. That is why it is so important that Congressman Doggett and Mr. Cummings and Mr. Welch have introduced this bill along with the 70 co-sponsors. It breaks through this argument. And I will tell you this bill or something like it is going to become law. This is not one of these efforts to just put forward a message bill. This is the answer to the political problem that everybody knows has to be dealt with to get to the only solution to lower drug prices purchased by Medicare. So we are incredibly enthusiastic about this legislation. We're going to work to make sure this thing passes the next Congress and eventually becomes law in the not distant future. It's not the solution to everything on drug pricing, but it is the solution to the problem of Medicare ripoffs for prescription drugs. This thing is going to become law, and today is such an important day because it marks the turning point on this decade-long ridiculous fight over finally giving the government the power it should have had in 2006. Thank you all so much for
Rob,
your
thank
leadership.
you. Thank you very much.
That was great.
Thank you for such a powerful statement. Two of our earliest supporters on this bill were Congressman Alan Lowenthal from Long Beach and Congressman Ro Khanna from Silicon Valley. I think, Al, you've got to depart to a committee in a moment. I'm going to call Ro up in a few minutes, but I want to be sure to recognize Nancy Altman, who's one of the nation's leading experts on Social Security and Medicare, who heads Social Security Works and also was very involved from the beginning in the development of this new bill. Nancy?
Thank you so much.
How do you want to add a word? Okay.
I do need to leave.
Okay, good.
I'm not an expert in this, although my community has been asking when I go everywhere in California and Long Beach about the horrors of drug pricing. And I've signed on to a lot of other bills that are messaging bills because we can. I'm so proud to be here because this works, and it's about time we do things that work. This has some teeth. This will bite. And that's why I was glad to become a co-sponsor, because now maybe we'll get some action. Thank you.
Thank you, Al, so much. Nancy?
As everyone in this room knows, we have the highest drug prices in the world. In fact, we Americans pay twice for our drugs because our tax dollars goes for the basic research and support of the new drugs that come out. It is so essential that we lower drug prices. The American people are divided on many, many issues, but we are not divided about wanting to lower drug prices. You can talk to Tea Partiers, union members, Republicans, Democrats, all ages, all races, everyone is agreed. The high price of drugs in this country is outrageous, it is unconscionable, and we must reduce them. We see examples all the time. You know, we all can see the face of Martin Shkreli, who was a poster child, but he was the tip of the iceberg. All of the big pharma, you have prices that are just unconscionable. There was a recent cancer-fighting drug that was approved by the Food and Drug Administration. The research for that came from the NIH, and yet you know what the cost of the treatment is? $475,000 just got approved. Imagine that you are on a fixed income, your sole source of support is your Social Security check, which averages $15,000 a year. That's the average. So you may be living on $10,000, $12,000. Imagine being faced with these high drug prices. They are an indirect cut to Social Security. We hear all the time, and they are not just made up stories, they are real. There are so many seniors among us who are cutting their drugs in half, who are not taking drugs in order to have food. That, again, is unconscionable. This legislation, all of us owe a real debt of gratitude to Representative Doggett and the others who are sponsoring this very, very important legislation. It will result in lower drug prices and will actually widen access so we can all have, in the richest country in the world, at the richest moment in our history, we should be able to have the health care we need, Medicare for all, medication that we need. Thank you.
Thank you so much, Nancy. Thank you, and I want to acknowledge the physicians who are here with the National Physicians Alliance and with the American Medical Student Association. We appreciate the role you play, and I know you see these problems every day, but I'd like to call up one person who sees them every day as someone who has to deal with prescription price gouging, and that is Stahis Panalgidis. It's close? Close, thanks. Please come up and tell us a word or two about your experience. Thank you.
Thank you very much, Congressman. Between my Greek accent and my Parkinson's, I know my speech is not as clear as it should be. I promise to try my best, and I understand copies of my remarks are available. I need to make sure I read my remarks correctly. So bear with me. I'm here today as just one of millions of people across the United States who is very concerned about skyrocketing drug prices in our country. I am 80 years old and worked for years at the World Bank, the Organization of American States, the Ford Foundation, and at private sector companies. From 2005 to 2011, I was resident country director of the Millennium Challenge Corporation in the Republic of Cape Verde. I have devoted my career to serving the interests of people everywhere, and especially of this country that I love. And I'm proud of my service. I'm proud also of my family, my dear wife Joy, 3 children and 5 grandchildren. 3 years ago, I was diagnosed with Parkinson's disease, for which there is no known cure. The effects of this disease can be mitigated through combinations of medicines. A few months ago, my neurologist recommended the new drug Rytary, R-Y-T-A-R-Y, an extended release medication approved by the US Food and Drug Administration, the FDA, in 2015. I do have a robust medical insurance with Medicare A and B, plus supplemental coverage through the Mutual of Omaha at a yearly cost of $4,300, plus Express Scripts Medicare D. It never occurred to me that even with all these plans, I may not be able to afford my medications. When I learned that Rytary would cost $400 plus per month, close to $5,000 a year, I had to reject it simply because I could not afford it. Let me tell you a bit more about Ritalin. This drug has 9 patents, the last of which will expire in 2028. This means there won't be a generic on the market to challenge the cost of Ritalin for at least another decade. The consequence is that people like me, and there are millions of Americans with Parkinson's disease, will continue to struggle to afford it. In fact, most are unlikely to afford it. Let me share with you a more recent experience with drug prices of my medications. This very last Friday, July 20th, I picked up from my pharmacy at the Giant Grocery in Arlington Road, Bethesda, prescriptions ordered by my neurologist for my Parkinson's. Thanks to my insurance, I paid $30 for carbidopa levodopa, very important for Parkinson's, and $69 for the generic medication entacapone. That's E-N-T-A-C-A-P-O-N-E. If I had not had the insurance cover, the cost of these same prescriptions, as shown in the receipts that I was given, would have cost, carbidopa levodopa would have cost $606, and then entacapone would have cost the shocking price of $1,370, 20 times more expensive. That's indeed why I'm so grateful to Representative Doggett, Cummings, and Welch for introducing the Medicare Negotiation and Competitive Licensing Act, because it would allow Medicare to negotiate in accessible, reasonable prices for drugs such as Ritalin. Under this bill, as you heard, the Secretary of Health and Human Services can work with manufacturers of Ritalin and other pharmaceuticals as they negotiate a fair and affordable price without putting patients like me at risk. The competitive licensing portion of this legislation will give the Secretary real leverage to negotiate with the drug competition. And if negotiations fail to come to fruition, and this is very important, I think, in being an economist in my profession, the Secretary can authorize another company to manufacture Ritalin, following the price to come down so that patients like me can afford it. As a patient with progressive and incurable disease, I deeply value innovation. I need medical and drug innovation to continue to fight this disease, especially for Parkinson's in this case. But none of the innovations will matter if at the end I will not be able to afford it. I urge the House and the Senate to act swiftly on behalf of patients like me to pass the Medicare Negotiation and Competitive Licensing Act. Thank you, Representative Doggett, Cummings, and Welch, for standing up for me. I'm looking forward to the rest of Congress to join you. Thank you so much, and we need no monopoly for drugs. Thank you again.
Thank you very much. Appreciate it. Thank you very, very much. So thank you so much for sharing. As I mentioned, Congressman Ro Khanna has been a leader in this issue and joined early on in our efforts with this new legislation. And you add a few words and then stand by to answer any tough questions.
Well, I will be brief, especially after such an eloquent statement. I just want to thank Representative Doggett. He is brilliant on economic issues when you talk to him on the House floor. And this idea is actually a pro-market, pro-competition bill. I want to thank Representative Peter Welch because he's been a moral voice on this. And I just want to make one point, which Rob alluded to. You could call this the Taxpayer Savings Act. Saves $16 billion. Now, you've all seen the speaker with his charts, right? Medicare is going bankrupt. Medicare is not going to be viable. And yet, he doesn't want to embrace free market competition principles that would actually reduce the cost of Medicare. He is giving a state capture to a pharmaceutical industry, basically a corporate handout of taxpayer money. And what this bill would do would take market principles, competition, to make Medicare long-term viable and save costs. So anytime the speaker lectures us about deficits or lectures us about the costs of Medicare, he has absolutely no moral authority until he supports a bill like Representative Doggett's. Thank you.
Thank you very much. A really good point. Are there any questions? Yes, sir.
The consensus bill that was introduced earlier this year, probably last year. It has Medicare price negotiation in it. It does not include compulsory licensing. Do you have the support of leadership for compulsory licensing?
Well, first, I'm not sure there is a consensus bill. There are several Medicare negotiation bills that have been introduced over the last several years. I think I've been a co-sponsor of every one, and I think Peter's been a co-sponsor, and Elijah probably most of them too. This is a new approach. I have talked and received encouragement from leadership on this, and the fact that we're nearing 70 co-sponsors from across the caucus, a wide spectrum of the caucus, I think is a good indication that this bill has a good chance of being considered. It is a new concept that has not been tried before. I think it meets directly, as Rob said, the false argument that the formularies that Part D companies rely on now and that the Veterans Administration relies on now might in some way deny some senior, some person who relies on Medicare access to a life-saving drug. We want all of the drugs to be out there. We simply want competition to work to bring down the prices. You want to add something, Peter?
Yeah. You know, I want to add something. There's a premise in your question that I challenge. We don't need permission from anybody. This is rank and file driven. And it is a result of the fact that people are getting hammered. And our responsibility is to act. And this is going to have widespread support in the Democratic caucus. And I think by some Republicans who are sensitive to how their constituents are being hammered.
Good point. Yes, sir.
John, it seems like President Trump is in agreement with you all that he wants this. Do you think he, I guess, underestimated the power of his bully pulpit? And do you think HHS Secretary should be doing more right now to
Well, I think, yeah, candidate Trump is in full agreement with us. President Trump, I'm not so sure. Peter could speak to the meeting that they had over a year ago, but nothing's happened since then. Peter and 50 of us joined in asking President Trump last year to do something about the taxpayer-financed drugs that Nancy referred to. We never got a response. And President Trump turned over his drug policy at the Office of Management and Budget and with Secretary Azar to pharma executives. Secretary Azar has made some very negative comments about negotiation. So what we'd like to do after we have a new Congress, I think we're obviously laying the groundwork for that new Congress and know that this Republican Congress will keep saying no. When we have a new Congress, we want to present President Trump with exactly what he said he wanted as candidate Trump, and to add to that negotiating authority the competition that he says that he supports in so many other areas.
Mr. Rob, can you answer that too, because you were there in the meeting with Trump?
Look, there's nothing, you're asking a question where the answer is obvious. If he agrees, act.
Yeah, we as several have said, we are about not just speeches, but about getting some action. And you can see there's no action because there are no results. The lower prices that were coming in 14 days aren't here. He didn't run on a platform of, I'll keep prices high, things won't get any worse. He talked about making things better, and that's what we want to work with him to do. Are there any others? Well, I want to thank everyone who participated, certainly for your sharing your story and for your expertise and for the many groups that have joined in endorsing this. Yeah. We're putting this out not the day a new Congress is sworn in, but well in advance, so that we can get the stories from people like you who are suffering today, and so we can hear from experts, academics, healthcare providers all over the country, and come up in January with the various adjustments to this bill we need to make it a bill that can work and solve these problems. I believe we can do that, and look forward to the process over the coming months, to the new Congress that can bring us success on this matter. Thank you so much.
Thanks.